South Africa's COVID-19 death toll is fast approaching the 300 mark, I beg your pardon. This as the Health Ministry has recorded 22 new deaths, bringing the total of coronavirus-related casualties to 286. 918 new positive cases have also been recorded in the past 24 hours, bringing the country's total number of confirmed cases now is 16,433. But just how do the COVID-19 statistics in the respective provinces fit into the national picture? So this is what we're going to do here on Morning Live. We're going to be inviting all of the health MECs, province by province, to come and talk to us and give us an understanding as to how it works. I mean, currently the Western Cape has clocked the 10,000 positive cases mark and accounts for more than 60% of the country's total. Gauteng still has the second highest number of infections, but drastically lower at over 2,300 cases. Now, the Eastern Cape, which has since moved to occupy third spot, now has a total of 2,052 recorded positive cases to date. 39 people have since died in that province, but there are also 839 people who have since recovered. So, as I mentioned, in the coming weeks, we as a program will begin to update on provinces on a bi-weekly basis, and today we begin with the Eastern Cape. And to help us unpack the situation in that province, we're joined now by the Eastern Cape Health MEC, Sindiswa Gomba. MEC, good to have you on the program. Thanks very much for being our guest.
Thank you for hosting me.
All right. MEC, let's look at the statistics that are coming out, obviously, on a daily basis. And as of Monday, the Eastern Cape had 2,052 cases. That's 12.5% of COVID-19 cases. Are you able to give us now the current update?
Thank you, Leanne. The numbers that you are having are correct. We are really at 2,052. And that in itself is a number that has been derived from 39,401 tests that we have actually tested. And out of that, we have got active cases of 1,174. But when you look at that, we also agree we have got discharges of 839. And that's unfortunately at 39. But when you go back to look at screening for the province, we've surpassed the mark of 1.2 million. We're now standing at 1.2 million 20, and I think about an extra 700 that we have. We're worried, of course, with the escalation of numbers in the Eastern Cape. And there's an issue that we are really not able to grapple with, which is the borders in Aberdeen and Sedama, and the coming in of deaths from majority of them from the West Cape, of people who come in COVID patients, some of them, others of course are not COVID, but we are picking some kind of challenges from those kind of funerals, that after funerals would then be swamped with people who want to be tested, would also be swamped with people who feel they've got symptoms. But when we get to those villages, we find that there are also positive people. That for us is a concern.
So, okay, let's just quickly have a look as well at the tests that have actually been done in the province. What is the figure sitting at for the total number of tests that have been done in the Eastern Cape? What are they?
We are standing at more than 39,000. Maybe to be exact, we are about 39,401 currently in terms of tests that we've done.
Okay, so those are the tests. And I just want to bring up a bit of a concern with regard to the tests, because I know that there was an article doing the round, and it's comments that have been brought forward by Dr. Siva Pillay that some swabs that were sent for testing have been regarded as unsuitable. What is your response? I'm sure you've read the article and the comments that Dr. Siva has given with regard to the testing done in the Eastern Cape. Let's talk to that. Are you concerned that there is a problem with these kits and with the results that are coming through?
What I will speak to Leanne, not necessarily speaking to Dr. Pillay's issues, I will speak to the fact that in terms of our own tests, there are tests that have come inconclusive, and those tests have been redone.
Okay.
So we do not count redone tests on top of these statistics. We still maintain the same number of tests when we get such reports. Because when we get them, they go back to exactly saying, this test that came through was Sindiswa Gomba, and unfortunately it's inconclusive, would request a redone, and we do exactly that.
How many tests are inconclusive? I mean, because at the end of the day, this person whose test has gone in for, evaluation, it may come back inconclusive, but they may be positive. Then they've got to be tested again, and there may be a week in between this, and they have been in the presence of a lot of people. How many inconclusive tests have come back to you?
I will not be sure now as per an update, but I know then that we only had 8. And I'm not sure about any number that goes beyond that.
Okay, so 8 is what you have as inconclusive tests.
It's what I had then, and I've not updated that.
The other issue, and perhaps you can give us clarity on this one, is the transportation of the tests that are done. Are they actually done in Johannesburg, or are they done in the Eastern Cape? Because what Dr. Pillay again is saying is that these tests are transported to Johannesburg. Obviously, we know there are no flights. By the time they get there, they've dried up and they don't give adequate results. What is your understanding of this?
I'm not sure where he gets his facts, but let me explain how our process is working. Initially, our tests done in NICD, which is in Joburg. Even at the time of them being tested, it was during the time that we still had flights. But when we did not have flights, we were lucky because the Minister of Health had declared our own NHLS laboratory in Port Elizabeth to be the one to be used. So our tests are no more going to Johannesburg. Our tests are collected in the specified vehicles and are taken immediately by a courier to Port Elizabeth. I am sure Dr. Silva Pillay is speaking to the old method of what we were doing then. But even then, they were not traveling by road. They were getting onto flight. And after flights were off, it was exactly the use of the one in Port Elizabeth as a laboratory.
All right. Well, I'm glad you've put that through, because I think it does obviously speak to a lot of concerns about people that are worried that, the testing in the respective provinces, and today we're speaking to the Eastern Cape, are not conclusive and not giving enough of a picture as to what is actually going on. One of the other questions I need to ask you is the backlog. What is the backlog of testing looking like in the Eastern Cape?
Well, the backlog, Leanne, I will be lying here if I give you an exact number, but I know on the basis of the influx in Aberdeen, that's when we started to pick, because with the workers from Ceres in Cape Town or Western Cape, we picked that in a day we were able to be looking at 10,000 people screening at the border and equally testing those who were actually found to be having symptoms. And that in itself has actually stretched our laboratory, and we will complain both in terms of test kits and the yield out of what we use in terms of the number of tests that we run, equally what we are able to find. But that didn't stop us from screening those people, because we're not sure what could be happening during the time. Out of what we did in 1 day or 2 days in Aberdeen, we got 144 people were positive. And you would tell that there are a lot of others that unfortunately were going through the unofficial borders into the province, and we find them now in the villages. Hence, we'll find that we've got numbers that are going up in terms of the outskirts, which are not necessarily at the border area, but where people have actually managed to get to their homes. And in those villages, some people are complaining to say, we've got somebody who has just actually joined us, but we're noticing that this person comes from Cape Town. Maybe the seasonal work is over and this person is coughing. This person gives us shares and fears in the village. And there's that anxiety. So we are kind of following on such cases at the same time while we are doing our work. MEC, you have been criticised, and I think you may have mentioned it again now in your answer, of
perhaps shifting the blame and saying that the cases that you claim and the province's cases are coming from the Western Cape. You know, instead of admitting that perhaps your own screening processes are not working well enough and were found wanting when these people actually came into the province in the first place. Would you like to speak to that?
I'm not sure how we are blamed, but I would actually understand it in a context of not wanting to speak the truth. If you were to look at the statistics and go back, when we had the time before closure and the lockdown, you saw in your pictures that we had floods of people in the two borders, Tsitsikame and Aberdeen. I don't know how then that can be turned not true. Secondly, when we had the 7-day window, we saw numbers of people who were termed that in a day we're able to see 10,000 in a border alone. And I don't know how then again that is taken as lying, because that's exactly what happened. And when we were shocked, because nobody informed us and nothing else, we were forced to immediately move some to quarantine areas in Fish River and in Pekweni, because we were not really ready to get such numbers at once into the province. I don't know how, if we're testing people from that specimen and we're able to get 52 in one day, 56 the following day, and up to now, we're able to record that during that time alone, we got 159. That's not a lie. Those tests can be checked. Those tests can be followed because tests are kept as records. I do not believe that it is a lie, but however, I am not here to start to say the truth can now be bent and not be said the way it is.
MEC, in your opinion, looking at the infection rate, the death rate in the Eastern Cape, and we're only talking provincially, there of course are talks that perhaps provinces will be able to move to different levels. So, you know, one province may be at level 3, another at level 4, perhaps even one at level 5. Where do you believe the Eastern Cape belongs? Some are calling for the opening up of the economy and seeing people moving out. Are you satisfied with how you're controlling the situation now? You've had the health minister there twice. You've had the president visiting you as well. How are you feeling? Are you comfortable to open up the Eastern Cape more?
It is for that reason, Leanne, that as the Eastern Cape, we upped our own strategy. Remember, the strategy of the Eastern Cape initially was about screening, and we're going into mass screening. On the basis of us looking at the stages and the opening, I would not be able to comment on that and start to say we should be at 3, we should be at 4. However, there are challenges in different areas where our own people are not observing all the actual regulations that are there. So one might say, probably as a province, we might be able within the national regulations to actually have our own guidelines for certain areas as to actually being able to combat. But the strategy that we have now upped and reviewed is actually saying, whilst we are still following on positives, let us now take out all the kind of conduct that have been because of this positive person and put them in a quarantine. And it is only after that testing that we've done in that quarantine that we're able to release those that are negative and move those that are positive to isolation. Yeah. So we are now getting to a point as a province where we're not giving so much choice, though we know it's their right, of self-isolation, in particular where people are very overcrowded, where people are in shack areas, where people are in informal settlements, where people themselves have got families in their homes, and we suspect or are convinced that self-isolation in this case will not work. So in that strategy, we are now taking our areas into clusters beyond just a hotspot, taking into clusters, closing that cluster, deploying people there somehow on a permanent basis so we can be sure that they're working in that area, not going to move until they've combed that area and actually removed whoever is a PUI in terms of that area into a safe place where we can release them only when we know they are negative. So my view is that the changing of that statute would actually make things better for us in making sure that we are really now closing on the gap the infections.
MEC, I've got 30 seconds to wrap this, but the Cuban doctors that have arrived in the province as well, where will they be located? Where will they be situated to try and help the province?
Thank you, Leanne. As you know, we've got only 20 doctors that have come. And out of the 20 doctors, we've got a mix of family physicians, epidemiologists, biomedicals, and biostatisticians. And when you look at that mix, we are going to immediately prioritize in terms of numbers. All our districts are going to benefit, but in terms of numbers, they will benefit differently. We have got Port Elizabeth, in particular Nelson Mandela area, which is the highest, followed by Buffalo City, followed by Chris Hani, followed by OR Tambo. Those will get a large chunk of the numbers of those doctors, but the rest will get maybe one on the basis of saying they are working with our local doctors anyway. Right. So the strengthening of them being part of them would then be highly appreciated.
MEC, I've got to leave it there and wrap you quickly. Thank you for talking to us here. Eastern Cape Health MEC Sindiswa Gomba giving us an update from the Eastern Cape side.
Thank you. Thank you very much. Thank you very much.
It's a pleasure. Got to say goodbye, Sakina. Goodbye.